Hi, I'm Dr. Raghu Athré with Athre Facial Plastics. I am a double board certified facial plastic surgeon specializing in facial rejuvenation. I would like to create a talk about submandibular glands. So this video is about submandibular glands and all about them and how they relate to facelift and facial rejuvenation surgery. So let me kind of give you a little bit of background information on how we got here. So submandibular glands are basically two glands that live on either side right in this area. Okay, there are some minor salivary glands. What do I mean by minor salivary glands? So spit glands are broken up into major and minor. The major salivary gland is your parotid gland, which lives right about here, and it makes the vast majority of the saliva that's produced in your mouth. You've got other glands, such as the submandibular glands. You've got glands in the inside of your mouth. You also have glands underneath your tongue. All of these glands together, probably put together, make up less than about 10% of the total salivary production of your mouth. So they're not as important with respect to the amount of saliva produced in your mouth. So what is the link between submandibular glands and facial rejuvenation surgery? So essentially, one of the main things that people want when they undergo a face neck lift is a very sharp defined jaw and a sharply defined neck. So as we age, what can happen is the glands that live right here can actually start falling down a little bit. So all of these tissues in here kind of act like a hammock and hold all of the tissues up inside. Well, over time, some of those tissues tend to lax a little bit. You lose some of the structures, and you can actually have those glands become ptotic or falling down. So in these patients, what happens is when you do a neck lift and you tighten this area, you can see this secondary bulge right here. So you see the sharp defined jawline, a nice neckline, and you see this bulge right about here. So to purists like me who just really want the sharpest jawline, the sharpest neckline, I hate it. I hate that secondary bulge. So one of the things that can be done is shaving of the submandibular gland. So when I tell a patient, hey, listen, I may have to shave your submandibular gland, the first question they ask me is, oh my God, will I not be able to make spit anymore? No, you're gonna make just as much spit as you've always made, or saliva. Because remember, the submandibular gland is a minor salivary gland, number one. Number two, I'm not removing the whole gland. I'm merely removing a portion of it. So how do I decide how much to remove? That's probably your next question. So when we look at the mandible, this is a fixed bony point. The next point I have is this thing called a hyoid. So we can feel the thyroid cartilage, which has a notch, and above it is the hyoid. That's the next bony structure. If you draw a straight line between the jaw or the mandible and the hyoid, we get a plane. If that submandibular gland sits below that plane, I need to remove a portion of it. Otherwise, what's going to happen is when I tighten this up, you're going to have a secondary bulge. So I am going to show you a picture of a patient here who has had a facelift in the past. She's a very slender person. She doesn't have a whole lot of tissue, and the surgeon did not remove the submandibular gland. And you can clearly see that she has a secondary shadow right there. That patient is coming up for a revision facelift, and one of the reasons she wants a revision facelift is because that bothers her. She wants a sharply defined neck and jawline. Take a look at this little shadow right here. And it's even more visible right here. This is the submandibular gland, okay? So she has a very sharp jawline, but you can see that little outpouching right underneath it, giving rise to that double bubble, okay? So this is one of the indications why we would consider doing a submandibular gland resection or partial resection in order to sharpen that jawline. Okay, so how do we decide how much of the submandibular gland to take and all of the relevant anatomy? So let's take a look. This is a cross-sectional view, and you can kind of see the mandible from the inside of the mouth, and you can see the muscle here. This is the mylohyoid muscle, and you see this gland right here that kind of looks almost like a horseshoe. okay? One of the ways that I judge if I'm going to need to do submandibular gland work, first look on the outside, see if you see that little bubble. But internally, I call it the plane idea. I imagine an imaginary line from the mandible, from the bottom of the mandible to the top of the hyoid bone right here. This red line demarcates my plane. I'm gonna blow that up a little bit. Here is that red line again, demarcating my plane. And if you look at this right here, you can see there's some gland that's living below that plane. So if I don't take out gland in this anatomical dude's drawing, I'm going to have a double bubble sign. So here is what submandibular gland looks like when it's actually removed. To give you a scale, this piece of gauze is about 4 inches by 4 inches here. So it's probably about an inch, I would say, in size, and it's probably about 3/4 of an inch tall. And here I ended up taking out in multiple pieces, but this gives you an idea of what that submandibular gland looks like when we remove it. Now, when you take it out, this is what you get. Look at the beautiful jawline definition on this picture right here. This is one of my patients. I did a facelift on her. Look at this jawline definition, and there is absolutely zero here that is taking away from that sharp jawline definition. Some of the controversies, so if you really do a lot of research into this area, there are surgeons who say they never remove the submandibular gland. There are surgeons that say they always remove the submandibular gland. What's right? Well, it kind of depends on the surgeon, the expertise of the surgeon, and how much experience that they have. So first of all, I was trained as a head neck surgeon before I did facioplastic surgery. So I'm very comfortable with the anatomy of the neck. So I don't recommend someone who is not very comfortable in anatomy of the neck to go ahead and say, hey, I'm just gonna go debulk someone's glands. There's a lot of anatomy in a very tight space, just like anything else, and you need to be extremely comfortable and adept at the anatomy and surgical manipulation of this. So that's number one. Number two, my personal philosophy is, do I remove everybody's glands? No. Do I remove nobody's glands? No. I really look and see where the problems lie. So if that gland is pooching out, I debulk it. I see this more often than not in very thin-skinned individuals who are very slender in the neck. Someone who's got a very woody and thick neck, much less likely that a little submandibular gland is going to create a shadow. But in someone who's very skinny, very petite, very thin-skinned, you're gonna see that shadow. And I think that removal of the submandibular gland, or a portion of, is the right thing to do in these patients. Again, much like anything else in surgery, there is no one absolute answer for every single patient. Every patient must be taken as an individual case, look at their anatomy, and figure out what needs to be done. So I hope this has given some idea to the listener of this about why we debulk the submandibular glands, what the reasons for it are, and what my protocol and philosophies are. Another question you might think about is, okay, so I need my submandibular glands debulked. What now? Does it affect me long term? It doesn't affect you long term. Some of the things that it does affect is that I tell my patients to stop citrus and spicy food for about 2 weeks after surgery. The reason for that is that gland can continue making saliva, and things like citrus and spicy food can cause that gland to make saliva, and leading to a siloma, or a collection of saliva in the neck. So those are some of the things that I tell my patients in their post-operative course if they've had submandibular gland surgery as well. Overall, they have done studies and shown that removal of the submandibular gland does not adversely affect the patient long term, nor does it adversely add any additional risk to the procedure other than the chance of a siloma. And the chance of a siloma can happen even if you do not debulk the glands. So I hope this video has been useful, educational, and you got something from it. I know this is a controversial topic, and therefore I wanted to present my take on it. If you have questions and concerns, hit us up in the DMs, hit us up in the comments. If you want to know more about things like this, please hit the like and subscribe button, or give us ideas for future videos. Until next time, Dr. Raghu Athré, Athre Facial Plastics, Houston, Texas.